Hi, I'm Dr. Joe Childs. I'm a board-certified chiropractic neurologist, and on this DVD today I'm going to talk to you about MS. I'm going to share with you some insights on how we effectively treat patients with MS, and we're going to go over our MS program that we do in our office. Before I do that, what I'd like to do is tell you a little bit about me. Again, I'm a board-certified chiropractic neurologist, and a lot of people will wonder what exactly is a chiropractic neurologist and how does it differ from a medical neurologist. Well, just like in medicine, you can specialize in medical neurology or you can be a specialist in orthopedist. In chiropractic, you can also specialize. And I chose to specialize in chiropractic neurology. And basically what we do is we go an additional 2 to 3 years of schooling and we treat patients neurologically. Now, the difference between a medical neurologist and a chiropractic neurologist is we treat patients without the use of drugs and surgery. And we're going to talk to you today how we treat patients with MS without the use of drugs and surgery. Also, I am functional trained in functional neurology, and that basically means functional neurology is drugless neurology. I'm also fellowship trained in childhood neurodevelopmental disorders, so we see a lot of kids with ADD and ADHD, things like that in our office. I'm trained in functional nutrition, and I'm also trained in blood chemistry. And I've also been trained in spinal decompression and spinal biomechanics. And prior to me becoming a chiropractic neurologist, I was an exercise physiologist. So let's get started. I want to give you some information about MS before we tell you exactly what we do. The big thing I want you to know is MS is an autoimmune disease. I don't think I've ever seen an MS patient that was not autoimmune. We're going to talk about how we modulate the immune system, how we help patients with autoimmune issues. So again, MS is an autoimmune disease. Your own body's defenses, your own immune system, the part of your body that's used to fight bacteria, to fight viruses, to fight cancer cells and things like that, is actually turning upon itself. And what it's doing is it's attacking the insulation, it's attacking the myelin or the covering of the neurons that you have in your brain and in your spinal cord. And that's what causes a lot of problems with MS. Now, MS is different for every single person. There's varying degrees of MS. Some patients go through life with just minor symptoms, and they may get a flare-up here and there, but for the most part it's very minor. Other patients may become seriously disabled, meaning the MS may really affect their nerves and the autoimmune attack is very strong. Most people lie somewhere in between, and so there's various courses of MS. One course is what we call a relapsing remitting, and a relapsing remitting is when your symptoms fade, then they return and come on and off for many years. And then the next thing we have is we have what's called a secondary progressive. That's where it starts off as symptoms coming and going, very similar to the relapsing remitting, but then eventually it becomes very progressive and then the MS gets very bad. Then we have what's called primary progressive, and that basically means that the symptoms are very bad right from the get-go. It becomes very progressive right from the start. And then the fourth type is progressive relapsing, and that's where symptoms come and go, but with each flare-up you get, the symptoms get worse and worse and worse as we go on. So they're really the four courses of MS. And you're probably sitting here right now kind of trying to figure out which type of MS you have. MS signs and symptoms. Well, there are lots of signs and symptoms of MS. It can be very minor symptoms up to very, very strong symptoms, such as paralysis. We can have muscle weakness and stiffness. The muscles will become spastic. You may stub your toe as you walk. You may feel like you've got just really tired, weak muscles. Your reflexes, when the doctor taps the reflexes, you may be very hyper-reflexive, or what they call the MSR reflexes they're very bouncy when they tap. Okay, you may have paralysis. You may have sensory problems like numbness and tingling, or like pins and needles in your fingers and things like that. You may have a test that we can run on you called Lay-Hermes sign, which basically means when you push your head down like this, you feel like shock-like pain that goes down into your arms, sometimes down your spine and down into your legs at times. You can have ataxia, which means you're less coordinated. You may have a hard time walking a straight line. You may feel sort of drunk at times, and that's because the MS can really affect some of the pathways in the part of your brain that controls balance, the cerebellum pathways. Again, you may have balance issues, dizziness, you may have lightheadedness, blurred vision, double vision. A lot of people with MS will have what's called optic neuritis, where it seems like they'll lose vision in one eye, or they'll have like a puff of cloud, or it becomes sort of gray and hazy over one eye. You may have bladder dysfunction or bowel dysfunction. You may get tremors in your hand. A lot of patients with MS have depression, and then some pain. Some patients with MS will have pain. It usually is not severe pain, but they tend to get some more pain than the average person. How do they diagnose MS? Well, a typical way to diagnose it is you have 2 or more attacks. So any of those clinical symptoms of MS, you have 2 or more attacks, they're saying, well, we better run some testing here. So they may do what's called a spinal tap. They'll check your cerebral spinal fluid, and they'll look for these bands. They're called oligoclonal bands. And then the third way is they'll do an MRI of your spinal cord, or an MRI of your brain. And what they'll be looking for are lesions in the white matter. The other thing is they can run is what's called a visual or auditory evoked potential. What a visual evoked potential is they're measuring the speed that your eyes can send a message or send light back through the optic nerve back to your brain. Okay? When you have MS and the covering of those nerves are starting to fade away, it's going to reduce the velocity that those nerves fire at. So medical treatment, what they do is during an acute attack, obviously you probably know this, they're going to use corticosteroids. But during the attacks, or if you're somebody that has progressive MS, you may have a constant attack going on, they're going to do what's called immunosuppressive drugs. And what immunosuppressive drugs do is they try to reduce the attack of your autoimmune system. So it really just dampens down the entire immune system and really reduces your immunity. Now, these drugs have side effects. I mean, patients that do the immunosuppressive drugs like Avonex or things like that, or they do the interferon, they're going to feel like they have the flu. They're going to feel like they have the chills. It can depress their immune system, make them more prone to colds and infections and things like that. It may bring out seizures or headaches or nausea or insomnia. I mean, there's a lot of symptoms that these drugs have. And I'm not telling you should be either off or on drugs. I'm not telling you right now, this video is nothing about me telling you that, hey, you need to be off your MS drugs. Because some patients with MS, they really, truly need to be on these medications. But what I'm telling you is that there's things that we can look for that can help you improve your MS symptoms and improve your function. We're going to talk about that as we go on today. So let's get started. So what makes us different than every other doctor you've seen? I'm sure you've been to a lot of neurologists, a lot of doctors with this MS trouble that you have. So we're going to talk about it. Well, what we do is we treat patients metabolically and neurologically. So what does that mean? So we treat their brain and we treat their internal functions. We treat their blood chemistry. So let's talk about it. Here's the thing. Your brain and your nerves, which is what's attacked when you have MS, mainly your central nervous system, your brain and your spinal cord, they need 2 things to survive. Your brain needs fuel. Your brain needs glucose, and your brain needs oxygen. Absolutely essential. So we use oxygen therapy. We're going to talk about that in our office. The brain also needs activation. The brain needs stimulation. And so we do specific types of brain stimulations to improve certain parts of your brain that are not functioning very well. So again, fuel and activation. We can look at this and say that's metabolic care. Fuel is metabolic care, and activation is the brain-based neurological care that we use for patients with MS. So let's talk a little bit about it. So I want you to understand, if you're watching this DVD right now, either you or a loved one has MS and you're concerned. I want to let you know that we leave no stone unturned in the care of your MS. We're going to check everything. We're going to make sure nothing is missed. Okay, so here's the things that we do under metabolic care. We're going to run a complete metabolic panel. We're going to run a lipid panel. We're going to run a CBC with auto differential. We're going to look at your thyroid function. Okay, now most people at this point will say, well, doc, I get these tests done all the time and my medical doctor tells me they're all normal. Most likely they are not normal. Here's the reason why. When a medical doctor runs these tests, they are looking at the laboratory ranges. So when they run your test and they look at the sheet that comes back from Quest or wherever you had the testing done, on the left-hand side of the page will be all of your values, and on the other side of the page are these reference ranges. These reference ranges are called the laboratory ranges. These are very inaccurate. They use bell curves. They look at the average of everybody giving blood in the whole country. So basically, when you look at people giving blood, I mean, if you sat over at one of these blood draw stations and you look at the people, there are some very unhealthy people there. People on oxygen and people that are sick and things like that. So you're the average of all of those people. What we use is what's called the functional lab values. The functional lab values are more sensitive. And basically what that means is what we call them the optimal ranges. We want to make sure that you're in the optimal range. Okay? And so what they are, that's the median or the average of all the healthy, non-sick people who are giving blood. So that's what we use, and it's much more strict. And when you're trying to develop optimal health, especially when you're dealing with an autoimmune disorder like MS, you want to make sure that you are as strict as you can be and as healthy as you can be functionally from the inside. I'll give you an example. Glucose, the functional ranges for glucose, the optimal range is 85 to 100. However, when you look at the lab ranges, they'll say that 65 to 110 is normal. That's not so good, because you could be like 109, which is 9 points over 100. That's called insulin resistance. That's only about 16, 17, 18 points off from having diabetes, and that would look normal to your medical doctor. Okay, and when you look at the low range of 65. Let's say you're 66 or 67. That may look normal. But what that's called is, it's called reactive hypoglycemia. It means you don't have enough blood sugar. Remember, your brain needs fuel to survive. It needs blood glucose. So if you have hypoglycemia, that's going to adversely affect your MS, without a doubt. Okay? So the other thing we do with metabolic care is we're going to do what's called an adrenal stress index. The adrenals are your stress glands. They sit right above your kidneys. And what they do is they secrete what's called catecholamines, which is epinephrine and norepinephrine and things like that. But they also secrete cortisol. And so we can do a salivary test. It's called the adrenal stress index. We can run it 4 times during the day to find out if you have adrenal glands that are secreting too much cortisol, or do you have adrenal glands that are really shot and overstressed, and you have what's called burned out or fatigued adrenals. That can adversely affect your blood sugar, and it can adversely affect, eventually it can cause immune dysregulation. And so we need to run this test if we're going to find out how healthy you are and how well you can heal. Okay? We run sensitivity testing. This is absolutely essential for all autoimmune patients. Patients that are autoimmune are typically autoimmune because there's something that's spurring along their immune system. And so they have what's called an antigen. And what an antigen is some form of food or some form of parasite. We're going to talk about this in a bit. But we want to run food sensitivity tests. So we're going to test you for gluten sensitivity. We're going to test you for casein sensitivity, egg sensitivity, soy sensitivity, yeast sensitivity. What these food sensitivities do, what these particles of food do, they're protein particles. And what they do is they get up into your bloodstream as they absorb through your intestines, usually the leaky intestines or leaky gut. And what happens is your immune system thinks that it needs to attack this protein. It thinks it's like a virus, or it thinks it's bacteria. And so your immune system is constantly trying to attack this food that you continually eat. And that creates an autoimmune response in your body. So it's absolutely essential that we test for this if you have any autoimmune disease, MS being one of them. When we do sensitivity testing, one way that we can tell is we've run this stool test. Now, a lot of people will say, well, Doc, I've already had allergy testing. I didn't have allergies. Allergies are IgE responses. IgE responses don't affect the nervous system. They're like peanut allergies and things like that, where you eat it instantly, have an immediate response. We're testing for IgG. IgG is more of a delayed response, and that can affect your brain. It can create brain inflammation. It can cause your body not to function good, and it can cause autoimmunity. And so one way we can tell if patients have sensitivity testing, of course, is to do the test. We have to run the test. That's the only way we can tell. But a lot of times patients with food sensitivity will have chronic fatigue, chronic pain, frequent indigestion. They may have fullness after meals. They may have some bloating after meals, frequent loose bowel movements, constipation. They may vomit often. A lot of these patients will have thyroid conditions, because the thyroid, gluten, when you have gluten sensitivity, eventually that causes an autoimmune attack on your thyroid and creates what's called Hashimoto's disease. Or you may have none of these symptoms at all, because sometimes this autoimmunity, this underlying autoimmunity, flies under the radar. The other thing we want to test you for is what's called a leaky gut. We test that with what's called an intestinal permeability test. And what we're looking for there is we're looking to see how the integrity of your gut is. Now, you have barriers in your body. You have the skin barrier. I mean, you cut your skin and bacteria gets in. You have the respiratory barrier, which is between the blood and your lungs and things of that nature. You have the blood-brain barrier, and then you also have the gut intestinal-blood barrier. And so what happens is when you eat, food is supposed to be fully digested as it goes down in through your intestines, and it's supposed to be absorbed through a semi-permeable membrane, and it's supposed to be absorbed in. Now what will happen is when you have a leaky gut, large protein molecules or peptides will actually get through the gut. The only thing that should get through the gut are fully digested amino acids. So when you digest protein, protein goes from proteins to peptides to amino acids if the digestion is happening properly. And then when it's down to amino acids, then it slides through the membrane of the gut and then it's used for your body. Your immune system can't detect amino acids because they're so small. So a gut is kind of like a screen door. It only allows in the air but keeps the bugs out. Well, if your gut becomes leaky, usually it becomes leaky secondary to poor blood sugars or secondary to adrenal stress or food sensitivities. What will happen is, now let's say you have gluten, you eat some wheat, okay, you eat some barley, some rye, things like that, and now your body is trying to digest this down. This food is very hard to digest, and what happens is it doesn't get down to amino acids and it slides through as a peptide. Well, what's going to happen is your immune system is going to notice that as an antigen and it's going to think it needs to attack that. It thinks it's a virus, it thinks it's a protein, it thinks it's a bacteria, or it thinks it's a cancer cell or something like that, so it starts attacking it. And that's how you develop autoimmunity. So one thing about autoimmunity is we have to determine if you have a leaky gut. So we do that with a specific test. We need to find out how bad your autoimmune disorder is. Again, patients with MS, it's an autoimmune attack on the myelin in their brain and in their central nervous system and in their spinal cord. It also creates brain inflammation. So we need to check you for an autoimmune disorder. It's so essential with patients that have MS. And so we're going to run immune panels. We're going to run what's called a T and B lymphocyte panel. We're going to run a cytokine panels. We're going to find out how your interleukin 2, your interleukin 4, your TNF alpha, which is called tumor necrosis factor alpha. We're going to run interleukin 10. We're going to run natural killer cell activity. Okay? There's two parts of your immune system. There's the Th1 and there's the Th2. Th1 is your T cells. Your T cells actually go out and do the attacking of the antigens. Th2 are your B cells. B cells produce memory cells. They produce antibodies. So they don't actually do the attacking. They go out and tag the things that need to be attacked. Well, when you have an autoimmune disease, it's been studied and researched that autoimmune diseases are either Th1 or Th2 dominant. And so your MS may be Th1 or Th2 dominant. So we can run the cytokines that are responsible for the Th1 process and the cytokines that are responsible for Th2. And so your cytokines for Th1 are interleukin 2 and TNF alpha. If that's real high and your Th2, which is interleukin 4 and interleukin 10, is low, then you're Th1 dominant autoimmune. Or it could be the other way around. If your interleukin 4 is high and your interleukin 2 and your TNF alpha is low, then you're Th2 dominant. Okay? And so what happens is when your immune system sees an antigen, let's say you're eating gluten, let's say you're eating some form of some type of food that you're sensitive to, it can cause your immune system to have a Th1 or Th2 imbalance. We need to test for that. The other thing we want to find out is, do you have an active antigen? Again, or do you have immune dysregulation? So you can have either an active antigen causing your autoimmunity, or you can have immune dysregulation. Active antigens are things like parasites. You can have a gut parasite that's causing that your body keeps trying to kill that it can't kill, that starts causing Th1 or Th2 to be too high. You may have a bacterial infection, a virus infection, a mold. You may have too much yeast in your gut, which we can test for. You may have a fungi in your gut. You may have protozoans, foods. You may have the food sensitivities, the gluten, the soy, the yeast, all that type of stuff, the casein, which is milk protein. You may have a heavy metal. Okay? These are things in the environment that spur along an autoimmune attack. Okay? And so we can test for these things. We can see if you have an active antigen. Now, the best indicator of an active antigen is the helper-suppressor ratio. It's called the CD4-CD8 ratio. And that's basically looking at helper cells versus suppressor cells. If you have more helper cells and less suppressor cells, then you have an active antigen. That means that your body's actually trying to kill some form of antigen. And you may be eating this stuff over and over and over again and creating sensitivities, and just, it's like throwing logs on the fire to your autoimmunity, which then affects your MS. And so if you have a CD4-CD8 ratio or the helper-suppressor ratio over 2.5, it's very likely that you have an active antigen. Then we have to look for the antigen. Or we can look and see if the ratio is below 2.0, then you don't have an active antigen. Then your autoimmunity is most likely due to immune dysregulation. And what is immune dysregulation? Well, your immune system needs proper substrates to function. And so it could be caused by dysglycemia, or too much blood sugar, hypoglycemia, too little blood sugar. It may be caused by adrenals that are way off. That's why we run the adrenal stress index. It could be caused by you having a long-standing anemia or thyroid dysfunction. So we have to run those tests also. We already talked about those tests. We run what's called a DNA stool ecology profile, which is going to let us know, do you have a parasite? Okay? Do you have a parasite that we need to send you back to your medical doctor for to give you a medicine to get rid of that parasite? You may have a parasite that's really affecting your immune system. We can also determine if you have good bacteria or bad bacteria. When you take antibiotics excessively, you start developing what's called dysbiosis, which means you have too much yeast and not enough good, friendly, healthy bacteria. We can see if you have too much yeast. We can look at your parasites. This is a DNA test to determine if you have that going on. So here's the deal. Autoimmune modulation versus immunosuppression. So let's say you're a patient, you have MS. We know you have an autoimmune problem. Let's talk a little bit about autoimmunity. Basically, autoimmunity, and we just talked about it, there is an antigen. And when you get an antigen through your leaky gut, it's either a food, a parasite, your immune system tries to kill it, and it tries to kill it. And the way it does that is by presenting the antigen, and when the antigen is presented to your immune system creates T helper cells. And then your T helper cells are going to stimulate Th1 and then eventually stimulate Th2. If that's constantly being stimulated, it may create an imbalance between Th1 and Th2. The antigen may continually put logs on the fire to make this worse and worse, and it causes MS flare-ups and things of that nature. So immunosuppression is what you're using when you take drugs. What the drugs do is just really shut down the whole immune system. Now, that's not such a good thing to do. You don't want to suppress your whole immune system because you need your immune system to fight cancer, to fight infections and things of that nature. Some patients with such long-standing MS may need to use immunosuppression. Okay, so we're not saying they should be off of these drugs for immunosuppression. But what needs to happen at the same time, at least, is we need to do autoimmune modulation. We need to find out, do you have sensitivities that are spurring your immune system along? Do you have too many T helper cells? Do you have these cytokines that are off? Do you have a Th1, Th2 imbalance? And are you eating foods that are bringing on Th1 and reducing Th2 and making the imbalance worse? So we talk about modulating the immune system. And what that can do is reduce the amount of logs that are put on the fire causing this flare-up in your immune system. So that's how we treat MS. Some patients can do purely autoimmune modulation. Patients who have pretty early MS symptoms, we can get that going and we can really prevent these flare-ups from happening any further. Some patients that have had MS for so many years, they've now turned on so many genes that they're expressing this autoimmunity so bad that they may need to use immunosuppressive drugs, but they may also need to do the immune modulation. See, to do immunosuppressive drugs, but not to look at what's causing this thing to constantly be flared up is not a smart thing to do. So we need to either do just one or both. Does that make sense to you? Okay. Now I want you to understand that a lot of people will think MS is just purely genetic. Genes load the gun, but your environment pulls the trigger. So what I mean by that, you may have the genes that make you more prone to MS, but when you have food sensitivities and immune dysregulation, and you have dysglycemia, and you have adrenal stresses, and you've got all this stuff from your environment, what happens is those genes become expressed. And the longer they're expressed, the tougher they are to stop. Okay? So that's the metabolic side. The other thing we can do on the metabolic side is we can test for H. pylori. That can be an antigen. It's an upper GI bacteria. We can test you for inflammation. Patients with autoimmune have brain inflammation and dysfunction. And so we can test you for C-reactive protein. We can test you for homocysteine. These are almost always elevated in patients with MS. We can look at neurotransmitters. We can have you fill out a survey and we can figure out, do you need support for dopamine? Do you need support for your serotonin? Support for acetylcholine? You need support for the neurotransmitter GABA or gabatone. We can run hormone panels to find out if your hormones are off. Okay? Once we find out the big picture, what you're sensitive to, how your blood glucose looks. Do you have thyroid issues? Do you have autoimmunity? Do you have Th1, Th2? We can then give you specific types of supplements and nutritional supplements to start to balance your immune system. It's been known that patients with MS, there's a higher incidence of patients with MS in colder climates. Why is that? Well, there's less sunlight, less vitamin D. Vitamin D modulates the immune system, so we put a lot of our patients on vitamin D. We use emulsified vitamin D. So what we're going to do is we're going to find out exactly what you're sensitive to, remove the antigens, try to balance the Th1, Th2 system. We're also going to use glutathione. Glutathione is the motherlode of all antioxidants, and it's very important in healing tissue and protecting you from things like heavy metals and protecting you from things like autoimmunity. So we're going to do specific non-drug therapies. You can use these with or without the drugs that you're currently on for your MS. So the question is, have you had all these tests performed? Have you had your Th1, Th2 looked at? Have you had all these tests? Most likely, no. And the reason why is there's some very strict standards of care that most medical doctors follow. Basically, they find out you have MS, they do a brain scan, they do a visual evoked potential, they look at your cerebrospinal fluid, whatever, and they put you basically on immunosuppressive drug. That's basically what they do. That's the standard of care. Most doctors are not going to think outside the box doing what's called functional medicine to see if they can help you, because they're not really trained in functional medicine. They're trained in medicine. They're not trained in functional medicine. That's probably why you've not had these tests. And a lot of times, if you are coming in as a patient, they'll say, well, doc, can my doctor run all these tests for me, my primary doctor or my neurologist has been treating me with MS? Typically, no, because they're not really going to know how to run these tests, and they're not going to know how to look at them. These are functional medicine tests. Let's talk about the neurological treatments based on specific neurological testing. So we talked about the metabolic side, the fuel side. Let's talk about the activation side. So we do a very specific neurological exam. We're going to look at your cerebellum, which is the back part of your brain right in here. We're going to look at your cortex in through here. We're going to look at the frontal lobes. We're going to look at the parietal lobes. We're going to look at the temporal lobes. Temporal lobe is going to be your memory. It's going to be your hearing. It's going to be your smelling. Your frontal lobes is going to be motor function. It's going to be patients with depression may have frontal lobe issues. We're going to look at the parietal lobe, which is going to be areas of your brain that sense things. Patients with tingling and numbness and things like that may have trouble with their parietal lobe. So we're going to do a specific exam functionally to see how those areas are working. The cerebellum, the back part of your brain, controls balance and coordinated movement. We're going to do comprehensive neurological testing. We're going to look at blood pressure, right and left side. You may have a left side of your brain not firing as good, and that may cause you to have higher blood pressure on the left side. We're going to look at tissue oxygen saturation. We're going to look at heart rate, salivary pH. We're going to look at all your reflexes. We're going to do specific eye tests to measure your eye movements. A lot of times we can find where areas of the brain are not functioning well based on eye movements. Your frontal lobe drives your eyes. Okay? Cranial nerve tests. We're going to test all the nerves that come off of your brainstem and go to your face. Okay? And we're going to do cerebellar tests. We're going to test your balance and your coordinated movement. We're going to give you specific treatment specific to the part of the brain that we find is not functioning well. We're going to activate that part of your brain. It may be a part of what's called the homunculus. It may be up in here in the leg. It may be down here in the face. Okay? We're going to look at those areas. Again, your brain needs fuel and activation, so none of these brain stimulations work without proper fuel. We have to do the metabolic side. We'll do oxygen therapy. We put patients on oxygen. Oxygen is fuel for your brain and nervous system, and every year past age 25, we lose our ability to utilize oxygen by 1%. And so what we do is we put patients on oxygen because it's very important. It's fuel for the brain. But what we're going to have them do is we're going to have them exercise. We may put them on an exercise bike or an elliptical or something like that. We may have them doing eye exercises on oxygen because that's fuel and activation at the same time. That's what makes a functional neurologist different than a medical neurologist. We're going to use fuel and activation. We use oxygen concentrators, which brings your oxygen up to 95%. We use that while you're exercising. It's going to activate the back part of your brain, the cerebellum. Okay. We may use different therapies. We may use something called an interactive metronome. An interactive metronome is something, it's a computer-based program that uses auditory, stimulation. It uses visual stimulation, and it also uses gross motor groups. This is really good for patients that have developed some paralysis, or they've developed some stiffness, or they've really lost their rhythm and their timing. So what happens is they have to listen to a cowbell, and they have to have timing and rhythm while they're doing a gross motor group exercise. We may use eye lights. Patients that have visual abnormalities, we may use eye lights to stimulate them. We may use our HemiStim program. We may use Rebuilder for patients that have numbness and tingling in their feet and things like that. We may use health lights, which is laser therapy. The whole goal of our therapies, or the interactive metronome, is to create neuroplasticity. What neuroplasticity means, and this is the hottest word in neuroscience right now, is that if you utilize certain parts of your brain and you provide them with fuel, those parts of your brain can become stronger. They can actually change, and they can become more efficient and improve your function. And it can happen at any age. Okay, and so that's what we want to do, is we want to drive neuroplasticity. We want to improve your mental and interval timing, and we want to improve your brain's efficiency and performance. The interactive metronome is a big thing that we use. It improves auditory processing, short-term memory, working memory, processing speed, cognitive resources, executive functions. The interactive metronome is going to affect multiple areas of the brain. It's going to affect the frontal lobes, the dorsolateral prefrontal cortex. It's going to improve the cerebellum. It's also going to affect the basal ganglia, which is the part of the brain when it's not working can create tremors and things of that nature. And it also affects the cingulate gyrus, which is more of the emotional side of your brain. It's called the limbic system. Again, so we can use all these different therapies. There's multiple therapies. We can do visual stimulation, again, colored lenses, eye exercises. I mean, the list goes on, but the goal is to stimulate weak areas of your body. Now, patients with MS, a lot of times will have back issues and neck issues and pain and things like that. And so we can use a machine called the active therapeutic movement. This is for patients that have pain when they bend to the right, pain when they bend to the left, or pain when they roll over in bed and things like that. And so we can put them in, support them in this machine, and we can exercise them in this painful range of motion. But when we put them in this machine, it won't be painful because it's going to support their core. And what will happen is we'll have them do this, and this will reduce pain. It's an incredible machine. We use that. It's active therapeutic movement. You can go to backproject.com. A lot of patients with MS, because they have poor muscle tone and things like that, will develop disc problems in their back, so we'll use what's called non-surgical spinal decompression. This is for patients that have MS, and they also may have herniated or bulging discs. It takes the pressure off the discs, but it's also a stimulation to the cerebellum. We also do biomechanical spinal correction in chiropractic care. Chiropractic care is very essential for patients with MS because it fires the joints in their spine and it sends the messages up to the brain, and it really increases brain function. But there's been a study done by a neurosurgeon by the name of Dr. Alfred Bragg, and what he found is that when there is a good curve in the neck, it puts slack on the spinal cord. And what he found, he was actually doing surgeries to surgically put that curve back into the neck of patients with MS, and he found that a lot of their symptoms reduced because it took the mechanical tension off of the spinal cord. When the spinal cord has mechanical tension and you also have an autoimmune disease, it really spurs along some of the lesions on the spinal cord. So what we want to do is we want to restore the arc in the neck. So this is a patient that had forward head, loss of curve in their neck, and as we corrected them, we put that curve back in their neck, and that's going to take pressure off their spinal cord. So we want to do some spinal corrective exercises, spinal corrective chiropractic care. So that's basically all the things we do for MS. Okay. Oh, I forgot one thing. We also do laser therapy because a lot of patients with MS, they do get muscle stiffness and achiness and things like that, so we can use laser therapy. I did forget one aspect. Laser therapy will eliminate acute and chronic pain, reduces inflammation, things of that nature. So that brings us to the end. So I want to ask you just a few questions, and we'll read these questions to you. How has your MS affected your relationships? How has it affected your family, your finances, or other activities? Think about that. I mean, MS can really affect a person's life. And are you enjoying life to the fullest? What has your MS cost you in time, money, happiness, and sleep? All right. Obviously, when you have MS, you're concerned. You're concerned that it's going to become progressive, and you want to do as much as you can to prevent it. Where do you picture yourself in the next 3 to 5 years if you do not do everything you can to reduce your autoimmunity? Now, what do I mean by that? You may be on the medications, and you may need to stay on those medications. But what happens if you have a food sensitivity and you've had it for 20, 30 years, or you have something in your metabolic system that's not working well, that's spurring along this autoimmunity, and you just keep eating it, or you just keep doing it, and you keep putting logs on the fire, and you're taking the drugs to reduce to suppress the immune system, but you just keep spurring the immune system along. Okay? Think about that. Are you doing all you can? And so you really, you want to really leave no stone unturned when you have MS. With it being as serious of a disorder that it is, you want to look at everything, and you don't want to leave anything unturned. Okay? And so what is it worth to you to be at your fullest potential? Now that's the last question. The reason why I ask that question is because the care that we do in our office can be tough. We may find out that you have a gluten sensitivity, a milk sensitivity, and leaky gut, and we may need to put you on a very strict diet to improve your health. So how important is this to you that you're functioning at 100%? You may need to come to the office and do oxygen therapy and spinal care and neurological rehabilitation. Are you able to put that time in? Is it something that you really want to do? And again, the reason why I ask that is because a lot of patients come in and we don't accept every patient that comes into our office. We only accept those patients that are really willing to go the distance to improve their health as much as they possibly can. So that's all we're going to talk about today with MS. If you're watching this video online, you can call our office, or you can opt in, put your name in and information, and we can send you information on how to receive a reduced cost MS initial office visit and evaluation. If you've already been a patient in our office, you've already been through the initial evaluation, you're waiting to come to hear my report of findings, make sure you watch this video thoroughly. Make sure your spouse watches it, so when you both come back, you can fully understand all of the recommendations we have for treating your MS. So thanks a lot. Take care.